All right, we're going to talk a little health and wellness today. We're going to talk about our hearts and how to take care of them a little bit better. Dr. Chad Rodgers, Medical Director for the Arkansas Foundation for Medical Care, now joins me. Dr. Rodgers, Chad, thank you very much for being with us. How are you holding up?
I'm holding up pretty good. Just survived Snowmageddon and trying to get back into the new normal post snow and COVID. Hopefully here soon.
All right, well, we're going to talk some heart health today. Let's talk about the importance of listening to your body and what your heart is telling you. I guess for people that might not know as much about those signs, are there physical signs that they would be aware of that your heart is telling you something's not right?
Yeah, the interesting thing about sometimes heart disease is that it does present in different ways. And, we all kind of get aches and pains or pulled muscles or, bumps and bruises that sometimes we just sort of chalk symptoms up to something else and think, well, that may not be something, but it could be something. But, I think it's important to kind of listen to your body. If something that kind of you don't routinely feel hasn't gone away, like if you're experiencing some shortness or breath or chest pain, or elbow pain, face pain, just kind of some of the other symptoms. Kind of, I think if you kind of rest and they go away, that's good. But then it's something that you definitely want to talk to your doctor about.
I think some people would maybe think, oh, maybe it's a little heartburn. Maybe I just ate something that's not,
Right.
sitting right with me or whatever. When do you know that it's something more serious?
Yeah, I think it's kind of funny. I went through this about 2 years ago. We had been traveling, and I've always been kind of in a pretty good shape, and exercised and tried to eat healthy and stuff like that. But I have some pretty good genetics. But I noticed a couple of times while on our trip that I was just sort of experiencing some shortness of breath that I wouldn't have typically had, and I wasn't having chest pain, but I was kind of having just this funny feeling. And then when we were flying back from our trip, and I had kind of just stayed up watching movies and had, in hindsight, the rest of my elbows on the arm rails. And so then when we landed in Dallas, I kind of was like, well, I've had shortness of breath and this kind of funny feeling in my chest, and now I'm having elbow pain. And so we landed on the ground. Of course, being a doctor, we are the worst. We ignore our symptoms all the time. But we landed. I texted a friend of mine that's a cardiologist and said, I don't think I'm having a heart attack, but I'm having some symptoms I haven't had. And he was like, come see me tomorrow. We'll get this worked out. And was really quickly able to rule out a heart attack. I was just having blood pressure problems. But I think it's those sort of subtle things. If you're at rest, sometimes people will have pain. But if you're up and doing some activity, I think a lot of people have been doing a lot of shoveling of snow the last couple of days, a lot of tromping around in the snow. If you feel sort of a tightness in the chest, something heartburn that doesn't particularly relieve with like an antacid, like a Tums. And then, you just kind of have these other kind of funny feelings. Your heart sits on the left side of your chest. So, that's usually where you feel it, but it can go to your back, it can go to your shoulder, to your elbow. Sometimes people will complain about pain in their face. And then sometimes people you just don't feel right. You just don't have the energy that you did. And it kind of came on pretty quickly. So, those are things worth asking your doctor about.
Let's talk about the heart is a muscle. How do you
Mhm.
exercise that muscle? It's easy to exercise your arm muscles and your leg muscles. How do you exercise your heart muscle?
Right. So as we age, we're all kind of focused on keeping our strength and keeping our mobility. So we do our exercises and lifting weights and kind of making sure we can still get up and down. But the heart is a muscle itself. It still needs to be exercised. So it doesn't have to be a marathon. It doesn't have to be something super strenuous, but something that you do kind of every day. So just even walking for 20 to 30 minutes every day, every other day, just enough that you can you may be a little bit breathless, but you can still talk is a good example of kind of the best way to kind of make sure you're getting a little extra heart muscle health in there. But it takes a little bit of time. Plus, it's a big stress reliever, and I think we're all feeling kind of caged in and feeling a little bit of stress. So stress has a lot of impact on your heart and on your other organs. So it's a good activity to get out there and try to just do some light exercise every day.
So men and women can experience heart attack symptoms differently. What are some of the common ways that we see a difference in terms of gender?
Yeah, so typically when you hear about what the heart symptoms I just described, those are pretty common in what you see among men. But women sometimes sort of have, atypical pain, or what not what you would typically think is associated with a heart attack. Maybe just some left elbow pain, maybe some pain into their arm, um, you know, some just kind of fatigue. So they may not present with sort of just that crushing chest pain that everybody talks about when you're having a heart attack. So women tend to have sometimes milder symptoms. They also, but a lot of times we do again discount those symptoms. So I just think it's important, if you're telling your body's telling you something, there's really no harm in going and checking it out. And again, people have been kind of afraid to go for routine checkups and to see their doctors because of the pandemic. But doctors' offices are working very hard to make sure that it's safe to get in and that your risk for exposure are low. You have to remember, heart attacks are still very common uh, problem in our country, and as well as the pandemic. So you got to got to balance it and take care of yourself.
So one of the things that people think about when they go to see a doctor is they don't want to rack up any extra charges if they don't need extra charges. But at the same time, an EKG is really kind of one of the best tools for measuring your heart health. When do you ask for one of those?
Yeah, so I think if you're having some symptoms and you're having some concerns, I think you bring them up to your physician. It's a very easy test to do. It gives you a lot of information. It takes a little bit of time because usually you have to go. If they don't have an EKG within the office, you might have to go over to the hospital and get it done. But it's a pretty easy way just to kind of make sure that nothing heart-wise is going on. You could kind of rule out that, and then if it is not your heart, you might want to focus on other things like reflux or those sort of things. But then also, just making sure you get in for your routine blood pressure screen and then your cholesterol screening on an annual basis.
All right, he's Dr. Chad Rodgers, Medical Director with the Arkansas Foundation for Medical Care. Heart health is a huge issue in Arkansas. It is one of the number one, or it's up there among the top leading causes of death and sickness in Arkansas. So, Chad, thank you very much for your time.
Yeah, thanks for having me.